Introduction to Melanie Klein. After Freud's followers, Ferenczi, Adler, Wilhelm Reich, they took their own ways. Jung had broken off with Freud even while Freud was alive. Some others also broke off with Freud while he was alive and continued after Freud passed away. Freud's daughter Anna Freud continued development of psychoanalytic theory in her own way. One important person at that time, apart from Jung, was Melanie Klein, who was developing after Freud a radically different way of understanding the human mind. And Melanie Klein never criticized Freud or said she was not following Freud, but she was developing something which was quite beyond what Freud had developed. So Melanie Klein comes out as a very important psychoanalytic thinker after Freud. Even today, her school of psychoanalysis, which is called object relations school, or rather in the category of object relations school, Melanie Klein's work is a major citadel of ideas. Melanie Klein started off with Freud, underwent her analysis, had her own personal tragedies and personal experiences. But she developed a very powerful theory of the internal world, a very powerful theory of pathogenesis, and a very powerful theory of how to heal the problems. The Tavistock School in UK is the center of Kleinian thought. Let us see the Kleinian school in an introductory way today. In one session, of course, we can have only an introduction, but let us go deeper and explore Klein's work, her ideas, and towards the end, see how the 12 common disorders we had understood from a Freudian point of view, how the same 12 psychological disorders can be understood from a Kleinian standpoint. And that will allow us to understand the same set of 12 psychological disorders from perspective of two schools, Freudian and Kleinian. And we will keep building this on as we explore more schools of psychoanalysis. We will have the same set of 12 common disorders and understand them from standpoint of various schools of psychoanalysis. So let us go into Melanie Klein's work. Let us start with the movement from Freud to Klein. How can we see this movement? How is Klein different from Freud? How has Kleinian theory come up different from Freudian theory. Let us take an overview of it. Freud's understanding of the child's mind was essentially from observing mind of an adult in regression. Adult patients who had regressed to their childhood state. That was the window for Freud to look into the way mind operated in the childhood. Does that mean Freud never saw children? Of course not. Freud did have child patients. He had his own children that he had observed. But his observations of children were limited compared to his observations of adults. So the primary way he could get into the child's mind was essentially by looking at the mind of an adult in regression. And therefore, his understanding of children was very different from that of Melanie Klein, who did direct child observation. So Klein's insights into the mind of the child came by directly observing the children. Children very young, and she would observe them for extended periods of time, and direct child observation gave her insights into the mind of the child directly. And this was a very different background from which the Kleinian theory emerged. Direct observation of the child. And this direct observation of the child happened in two ways. One, direct observation of the child till he grew up enough to play. And once the child grew up enough to play, observing the play of the child. Because in the play of the child, the unconscious exhibited itself. Even today, play therapy is a very powerful tool for understanding and healing children. And if you give them toys and ask them to create a story, you can see their unconscious coming out in play. So Klein's theorization was by direct observation of the child and direct observation of play. And this gave her insights which were very different from what Freud had accumulated. Freud's child is like a micro adult, where the difference is of scale, but there is no fundamental difference between a child and a man. The Freud's child is like a micro adult. So Freud does not go into how thinking develops. Freud does not go into how the difference between fantasy and reality develops. Klein, on the other hand, got an insight into the mind of the child and saw the predominance of fantasy in the psychological life of the child. That real life experiences were important. What parents did and what circumstances did to the desires of the children were important. But there was a complete world by itself of fantasy inside the mind of the child. And this fantasy world was far more in control of the constitution of the child rather than to experiences from outside in the early life of the child. This gave Klein a very different understanding of the human mind. The fourth difference between the Kleinian theory and Freudian theory is Freudian theory essentially is a libido-driven theory, a pleasure-driven theory. So in Freud's theory, we have both eros and thanatos, pleasure and aggression. But the predominance is of pleasure. The Oedipus complex is essentially a pleasure gain or a pleasure loss story, or a anxiety story of castration anxiety. Whereas Klein's theory essentially is an aggression driven theory, which means there is both pleasure and aggression at the root of psychological events, but predominance is of aggression. So in Freud, if we proportionately take a look at it, libido versus aggression, proportionately speaking, Freud's theory is a libido driven theory. Klein's approach is an aggression driven approach. Freud gave equal or more importance to real life experiences compared to the fantasy world. So the real world was as important or more important than the inner fantasy world. Whereas for Klein, the constitution is more important than the outside world. It is never either or. It is an and situation, not an or situation. So of course, in both theories, both are important. And in fact, all psychoanalytic theories, both are important. But the proportionate importance given varies from school to school. In the Kleinian school, proportionately speaking, constitution is more important than the outside experiences. Fantasy becomes more important than the real life experience. Real life experience can trigger a fantasy. Absence of a real life experience can trigger a fantasy. But on the whole, the fantasy world is very important, more important than the real world of events. And the fantasy events are more, even in quantitative measure, compared to the real life events. Klein talks about fantasy as being one of the most important elements in the psychic life. We'll come to it in the next slide, where we'll say fantasy is the beginning of the system psychological working just above the instinct. So instinct has a biological representation, and the moment then there is a gap, we don't know how the translation happens, but just above the instinct is the fantasy. And after the fantasy, the psychic life develops. Freud's school is called the drive frustration model, which means if we divide all psychoanalytic schools, we divide them into 4 or 5 categories. Drive frustration schools, object relation schools, independent schools, self psychology schools, and interpersonal schools. Freud's school essentially is a drive frustration school, whereas Klein's school essentially is a object relations school. What it means is this: fundamental to Freud in pathogenesis was frustration of a desire or a drive. That there is a drive which is trying to satisfy itself, and some constraint of reality or morality is not allowing that satisfaction, and this is the cause. This frustration is the cause for generation of negative affect and at times cause of pathology. In Klein's school or object relations school, the drive is secondary. More important is our need for an object, our need for a good object, and our need to relate to objects. So Freud's school essentially is a drive frustration model based school. Klein's school is an object relations model based school. Freud believed in a state of primary narcissism, which was a pre-object stage, in which there was no object, there was no sense of I and not I, and it was a stage of oceanic oneness. where there was no relating to any object. It was an object-free state. Klein did not believe in the idea of primary narcissism. She felt we always had object relations. If we don't have objects around us, we create them in fantasy. But there are objects always in the mind. And there is no state of the mind which is free of the objects. So the state of primary narcissism does not exist from a Kleinian standpoint. Recent studies of children are tilted more towards Klein than towards Freud. However, I do believe that a state of primary narcissism not only exists, but actually is a very desirable state if we can go into it in adult life on demand in control. In fact, the mature form of primary narcissism is actually the spiritual state of enlightenment, which is the goal of spiritual schools in India. And that also is an object-free state. And it is possible to experience those object-free states. May not be possible for every person, but those who have developed themselves spiritually or are lucky enough to have those rare experiences, it is possible to have a state free from objects. So more likely it seems to be to me that there is a pre-object state, a life of object relations, and a post-object relations state, again object-free state, where you actually get a mastery to be object-free or to get into object relations. Another difference, or rather a characteristic of the Kleinian school is this. Freud never talked about this point, but Klein and Kleinians do. The question is, at times, an object comes before us and it solicits a response of affect from us. Somebody you love comes in front of you and the emotion of love is generated, which was not active before the person came in front of you. So the object has solicited an affect. At times, affect creates objects. Let us say you are all alone in the mountains for a very long time and you feel the emotion of love and you want to express it to somebody, and if there is nobody, you can create an imaginary person in your dreams and allow the emotion of love to go towards that person. So here the affect comes first and the object is created. This is a point of contention in the Kleinian school, whether object solicits affect or affect creates objects. More people believe object solicits affect rather than the other way around. However, I personally believe it is the affect which creates objects. And then there is an equally contentious point in the Kleinian school of pure affect. Can you have affect without any object? This again is a rare experience which is common in the spiritual area but not common in the general population. So it is possible to have a state of pure affect without an object, object-free state, if one develops oneself adequately or is lucky enough to have those rare spiritual experiences. So these are rare experiences of a state of being object-free, a state of experiencing pure affect, a state of having no thought, a blank mind. These are rare experiences common in the spiritual realm, but unheard of at times, mostly actually, in the ordinary world that we all live in. Klein therefore went into and created this idea of a representational inner world, and she was more focused on the inner representational world of objects rather than the external world. So the socio-political, cultural, economic, historical, these elements of the external world, although they are very important in creation of our psychological templates, reality, some would say even psychological structures, Klein never focused on those parts. So Klein focused more on the inner world, and within the inner world, in the inner world of objects, that she called the representational world of objects. The inner representational world of objects, where every object outside was represented inside in a way which is unique to the individual. So this every person has therefore a representational inner world where everything outside is represented inside, along with our thoughts, ideas, feelings towards it. And similarly, we also have a representation of our own self, who we are in that representational world. There is therefore psychological activity outside of representational world, the end result of which is put into the representational world, as also there is psychological activity in the representational world once it gets created. So there is a cognitive commerce, an affective commerce, an energy commerce, and associations or termination of associations, binding of energy or release of energy happening by inside once inside gets into that representational world and certain parts of that representational world. So pathogenesis and healing then ultimately have to be understood in terms of the inner representational world. But Klein does not go into details of what is transformation, what is pathogenesis, how exactly pathology develops. Klein does not go into the process part of it in the elemental sense. She goes into it in terms of psychoanalytic phenomena she talks about, which we'll take up in a few moments, but she does not go into the energy dynamic, the affect dynamic, the cognitive dynamic, the insight dynamic of what happens in that representational world, which leads to a trauma, the manufacturing process of the trauma, or the operational process of healing. So the operational process in elemental terms, like if I say interpretation has led to transfer healing, how it has led to healing in the representational world. That kind of micro modeling of the representational world in operational process terms, that Klein did not do, but she was very fond of this idea of the representational world. Let us get into object relations. What is object relations? Because this is fundamental to the Kleinian school. Because the Kleinian school essentially is an object relations school. Klein says we are all essentially object seekers. Object relations is central to our psychological health, to pathology, and to healing. It is even more important than drive frustration. In fact, much of drive frustration happens in the context of object relations. Once we say object relations are central to our psychological health, then we look at what are the kind of object relations we experience. And the word object here is very important. Object does not mean in psychoanalysis an inanimate object. Usually we talk about a human being, an animal, and non-living things, and we say non-living things are objects. That is not the meaning of the word in psychoanalysis. In psychoanalysis, when we say the object, we mean any entity. So the word object is actually synonym of the word entity. So human beings are also called objects, not to demean or humiliate or look down upon. It is just a descriptive fact, etymological descriptive fact. So it is an elemental etymological element descriptive fact, and in that context or that standpoint we use the word object. We use it in a descriptive sense, not in a value sense. So when we talk about our psychologically relating to any entity, we call it object relations, and we can divide all our experiences of object relations into three: good relations, average or ordinary relations, and traumatic relations. Our good object relations add to our health, well-being, happiness, and quality of life. Average object relations allow us to live a life of average quality of life. And of course, we strive from there to get into the zone of good relations. Traumatic relations are the ones which get us into pathology. So traumatic object relations are the object relations which get us into pathology. And according to Kleinian view, we are essentially object seekers. We are object seekers even more than we are drive satisfiers. So much so that when we have an object vacuum, when we are all alone and there is no object around us, we either recollect objects which were once around us, or we create dream objects consciously or unconsciously. We create consciously objects of fantasy in daydreaming. Our unconscious mind also creates objects of fantasy in our daydreams. Even in our dreams at night when we are asleep, even while we are asleep, we are still creating objects. So we keep creating objects in our mind while we are awake, while we are dreaming, while we are awake, daydreams, and even while we are asleep and dreaming, we keep creating objects in our minds. So we are essentially object seekers. We can't do without objects. If objects are not around us, we create them in our minds. This creation can be recollection, or this can be creation by imagination. To fortify further the point that we are essentially object seekers and object relations is central to our psychological life, a very famous experiment was done on a group of monkeys. Baby monkeys were put in front of two statues of monkeys, straw monkeys, monkeys made of straw. In one monkey, they put the machine which was dispensing milk. So whenever the baby monkey would go to the breast of that straw monkey, that machine inside would give milk. The machine was put in place of the breast. And in the second straw monkey, the breasts were created in a way that they were experienced as the breast, but no milk was coming out. So in one straw monkey, milk was coming out, but it was like a machine, and it was not the experience of a breast. The geometry, the tactile feel, the visual look of it was not like that of a breast. And in the second straw monkey, it was more like the feel of the breast, but milk would not come out. And it was seen that baby monkeys preferred the straw monkey where they got the feel of the breast, even though no milk, over that straw monkey where they got milk but no feel of the breast. Not only that, those monkeys who spent their time more with the feel of the breast than in search of the milk, they came out to be psychologically more healthy than the other group. Let me not say psychologically more healthy, they came out more healthy and more happy than the other group. So this brings out the centrality of object relations, the centrality of the good breast, even in its role other than provider of the milk. And this probably is true for all mammals, definitely human beings. Let me not say definitely, but because it is true for monkeys, probably it is true for all mammals and therefore for human beings. Second experiment is about child observation on how early they can relate to objects. And is there something like an object-free life of the child? And these experiments have been repeated many times over with different designs. And the recent experiments tell us that we start relating to objects almost from birth. And these observations challenge Freud's idea of primary narcissism. Although on this point I still stand with Freud, despite these experimental findings, on the existence of the state of primary narcissism, on the possibility of experiencing a state of no thought, a state of pure affect without objects, and a state of no objects, no affects at all. I should not say no affect, because it is possible, no affect also is possible. I have not experienced it, but people have reported experiences of it. What we have is, it is possible to have a state of no thought, at least conscious no thought, even if unconsciously it might go on, but at least consciously there is no thought that I have experienced. It is possible to experience pure affect without an object that I have experienced. Some people report a state of no affect, no object, pure awareness. I have not experienced that, because what I have experienced, a state of no thought, was accompanied by the feeling of bliss. So bliss is an affect which was active. Some people report even that affect is not active. It is a state of pure awareness. So these are rare experiences we have yet to fully capture and understand. But recent experiments definitely are more towards Klein and less towards Freud's idea of primary narcissism. This leads us to exploring further what is so important to us in the domain of object relations, which is so central to development of pathology and healing of pathology. And this brings us to the idea of object loss. There are two central ideas in Kleinian thinking when it comes to pathology: the idea of object loss and the idea of object attack. So if we look at the whole of Kleinian thinking, there are 4 or 5 reasons for development of pathology. Core generic reasons. two very important of those five elements are the phenomena of object loss and object attack. What do we mean? Klein says, because we are object driven people, object loss generates in us very strong feelings of anxiety, pain, anger, powerlessness, helplessness, fear of death, fear of pain, fear of being tortured, fear of being mutilated, fear of being shamed, fear of being humiliated. Severe inferiority, at times even guilt, at times even shame. So object loss creates very strong negative effects, and this often leads to very dysfunctional fixations or very dysfunctional template creation. So object loss, particularly in early life, even perceived object loss, when the mother is not available for some time, maybe a few hours, and the child wrongly perceives that he has lost the mother, he has been abandoned. Even this perceived object loss is enough to create a trauma. Constitution also comes in. Post-traumatic experiences also are important. Pre-trauma experiences also are important. But object loss is a central concept in Kleinian understanding of pathogenesis. Second important element is object attack. That object is present, there is no object loss, but the object is a bad object, he attacks you. So loss of a good object or presence of a bad object, both are traumatic. And between the two, most people prefer presence of a bad object compared to, sorry, I should not bring it this way. Let me put it another way. If you ask somebody that between these two tragedies, tragedy one, that you lose a bad object, or tragedy two, the bad object is present with you but attacks you. So object loss is so severely desired to be avoided by human beings that a majority of people prefer presence of a bad object than losing the bad object and experiencing a object vacuum. So many people endure living with difficult people because breaking off with them and going through object loss is even more painful than being with them and facing the attacks. So between abandonment and a bad object presence, most people, majority of people go for preferring presence of a bad object than to have a vacuum and feel extremely lonely and all the feelings that accompany that loneliness. Feelings of anxiety, despair, helplessness, low mood, low energy, and so on. There is a whole list of negative effects which arise once we have an object vacuum and we feel abandoned. So object loss, object attack are very important elements in the Kleinian thinking. Between the two, or let me say not between the two, but some other constellations of object relations involve this. Object distancing, somebody who is close to us becomes slightly distant from us, and that itself creates a micro feeling of object loss. Object vacuum, when we are alone and there is nobody around us, gives rise to intense feelings of abandonment, loneliness, and if it goes on for a long time, we see people talking to somebody in fantasy. because the minimum need for human company and the minimum need for human communication is not met. People stop talking to imaginary figures. It is not psychosis. It is just the deficiency of human relations. Human relations are so central to our psychological well-being that if we don't get real people, we start talking and relating to imaginary people. We can see that in many old people who are all alone. Many times when they are alone and they are having a conversation in their fantasy, they are so involved that actually their whole body is involved into it, and we can see the movement of hands, legs and face, and the whole body is there as though the person is present. That is not psychosis, it is deficit of object relations. The other side of it, object gain. When we gain a good object, suddenly the whole spirit is lifted up. We feel very happy, energetic, positive. There is a spring in the step. And when we get a dream object, we gain an object which was a dream object, we have euphoria like mania. So in mania, what happens is the dream and reality become one. The ideal object that we wanted, now we have. And the dream comes true and we go manic. I should not say we go manic, I should say we go euphoric. Object abundance. When we have many objects around us, fortunate people who have many objects around them and are related to them in a good way. This is the goal that most of us have. Few of us can reach those goals, but we all have these goals of having many objects around us, good objects around us, and good relations with those good objects. From pathology point of view, two central points from object relation standpoint are the problem of object loss and the problem of object attack. And this object loss is felt mostly as abandonment. And we are all terrified of abandonment. And second is presence of a bad object which leads to attack. And we are all terrified of attacks, mostly from authority figures. And this is something, the fear of abandonment and fear of attack, they need deep and long-term therapy working to really be free from them. And in many cases, we are never completely free from them, but we are 75% free from them. Some people are able to work through it completely and be completely free from them. So, if we fear abandonment and attack, and these are the two primary fears we have in the context of object relations, then what is the opposite of it? What is the healthy goal? So if problem is the fear of abandonment, then the goal would be a good object who provides acceptance, who doesn't abandon us. Abandonment is a form of rejection in one way. So a good object, so if a bad object abandons us or a good object abandons us, let us say any object abandons us, what would be the healthy opposite of abandonment? It would be acceptance, protection, acknowledgement, admiration, and providing us with happiness. And the opposite of attack would be peace, protection, and happiness. So abandonment and attack are at the fear of abandonment and attack, or an actual abandonment and attack. They are at the central root of a large number of psychological pathology. And in personality disorders, we find the fear of abandonment and fear of attack at the center of it, regardless of which personality disorder we are referring to. In personality disorders, we also find uh, deficit of a good object in early childhood, a deficit of mirroring which would involve acknowledgement, acceptance, and admiration. In object relations, therefore, the central point is in early life, if you experience abandonment or attack, this creates the core for pathology right in childhood or in later life. And most of the times it is in childhood. Most pathology is traced back to childhood, and in most cases which are traced back to childhood, we see in the center something related to abandonment or attack. And Klein says early childhood experience of a good object is the key to good psychological health and even good physical health. So if we have a good object relations with our caregivers in early life, we are able to internalize those good objects inside of us. So if we find a good object outside that is good, reliable and stable, and we are able to relate to it in a safe way, and that is providing us with positive experiences, then over a period of time we internalize that object inside of us. And this internalization of a good, reliable, stable object is the center of good psychological health and at times even good physical health. In most autoimmune disorders, in most psychosomatic sicknesses, what is the central difficulty often is this: the person has not been able to internalize a good, reliable, stable object. And in uh, in therapy, therefore, the goal, one of the very important goals of therapy is to provide a therapy space and therapy experience to the patient, whereby he can internalize a good, reliable, stable object that he sees in the therapist. So in long-term therapy, one of the things that unconsciously happens is this: the patient is able to internalize a good, reliable, stable object. And often we see, even in schools which don't realize, which don't accept this concept, or they don't even know about this concept, this process actually is happening even if they don't know it. So if we look at the Ocean school, or if you look at ISTDP, in many of the cases we find that they are working with their own concepts, but what is happening in the depth of the mind is, over a long period of time, as the person keeps coming for therapy, and if the therapist is good enough, the person internalizes a good, reliable, stable object, and that actually shatters many of the difficulties and holdbacks on the path of healing. In many cases, this itself is enough to be healed. So this is a very important element of therapy process: the patient internalizing a good, reliable, stable object. In a healthy situation, this should have happened in the childhood. If this has not happened in the childhood, then it becomes a task of therapy to support and enable the patient so that this happens unconsciously. And before this happens, patients will of course test you many times to see if you indeed are a good, reliable, stable object. Let us look at how Klein starts in terms of her meta psychology. Klein starts theorizing, connecting with Freud in terms of his concept of death instinct. So Klein accepts Freud's idea of death instinct. Klein accepts many of Freud's ideas, the idea of unconscious, idea of death instinct, idea of the Oedipus. However, Klein starts her theorizing with Freud's idea of death instinct. And Klein says there is death instinct in all of us and it comes towards us. And to save ourselves from the death instinct, it is deflected outwards onto objects, and this is what we call aggression. So aggression towards object is actually deflection of death instinct, which is coming towards us in the representational world. And if we don't talk about the representational world in a more concrete form, in a more pervasive way, it may be a death instinct which is coming towards us for self-destruction. And part of it can be repressed, part of it can be sublimated, but that part which cannot be dealt with in any regulated way has to be deflected as aggression, and destruction has to be deflected on some object inside the mind or outside. Many people are not happy with Klein starting from or accepting Freud's death instinct. Substantially large group of psychoanalytic community believes there is no need for the concept of death instinct, and the idea of aggression is enough. So instead of going in for a meta-psychological model of eros and thanatos, life instinct and death instinct, they say pleasure and aggression is a far better set of elementals to start theorizing from. They also say there is no need to get into meta-psychological and mystical discussion of the death instinct. Rather, we can just start from aggression, that human beings have two fundamental hardwired objectives: survival of the self and survival of the species. Survival of the self would give rise to aggression, and survival of species would give rise to pleasure and sexuality. So there is no need, in their view, for a death instinct, but Klein starts from there. That there is death instinct, it comes towards us. To save ourselves, we deflect and it goes on to the object. Klein's meta-psychology also goes into the idea of whether thought is primary or fantasy is primary. Do we think between dreaming or do we dream between thinking? Klein's view is that fantasy is fundamental. What we call coherent thinking comes much later. It is like a small child wants to learn how to walk. Child gets up, tries to walk, fumbles and falls down. This fumbling in the mind is fantasy. Early life fantasy is our fumbling to learn to think. Our primary thinking, our initial pristine thinking is fantasy. Slowly we learn that what we are thinking is not true in the real world, and we have the capacity to differentiate it. It's an inborn capacity. So we are creatures of fantasy and reality both. We are neither creatures of pure reality nor creatures of pure fantasy. And because we have hardwired capacity for both, the capacity to reality also activates in childhood as we grow. So slowly we move from only fantasy to fumbling for reality to reality. But we are never fully in reality because fantasy is far more pleasurable and that is our default condition. It takes a lot of energy and exertion to really be in reality and coherent thinking. But it is our default condition. If we just drop down everything, by default we go into fantasy. So fantasy is primary, thinking comes later. The state of thinking has to be maintained. If we don't maintain, we fall back into the original fundamental matrix, which is the matrix of fantasy. Klein says, where the biological instinct ends and the psychological manifestation of that instinct starts, the first layer is of fantasy. And the early childhood fantasy is very different from later adult fantasy. So from that standpoint, we are actually thinking between dreaming rather than dreaming between thinking. It is just that we don't have the capacity to see internally how much dreaming is going on all the time in the conscious, the pre-conscious and the unconscious. Klein talks of two kinds of fantasy. Fantasy with F and fantasy with PH. Fantasy with F is the fantasy that is day fantasy or dream fantasy, which we know of or we can know of. Fantasy with PH is completely unconscious fantasy which has never come up even in daydreams or even in night dreams. Beyond would say those fantasies still have not been processed to the extent that they are still not alpha elements which can be used by the mind for dreaming or fantasizing. Such fantasy is something which comes up only in very deep therapy, where a fantasy completely unknown, never dreamt of, never fantasized consciously, comes up, and that is the root or a very important element at least in pathogenesis or healing. So Klein talks about these two types of fantasies. Another departure from Freud is Klein preposes the Oedipus complex to 2.5 years. For Freud, it was 4 to 5 years. Some Freudians say 4 to 7 years. But Klein preposes the Oedipus complex to 2.5 years. And I agree more with Klein here because I have seen dreams of children in this age group, 2 to 3 years, where one clearly sees the Oedipus at work. It may be that the proto-Oedipus might be at work in this age group before a full Oedipus, but we don't know what the differences are if there are any. So both of them are true. We see, if we see first time, we see the first time the Oedipus in 2 to 3, and very explicitly we see it 4 to 5. Even behaviorally we can see it in 4 to 5. But psychologically we can definitely see it at 2.5. Why does the Oedipus complex make appearance twice Or is it that the first time it is a more low-key appearance and a full vivid appearance later? That would require differentiating the two appearances of the Oedipus complex. Or it can be that it starts at 2.5, goes on for some time, and then deactivates for the anal stage in a sort of a Oedipal latency. Then it might start at 2.5, go on for some time, then get into a sort of Oedipal latency to allow the anal stage to happen, and then restart. We need to reformulate more clearly this paradox, not a paradox, but this not completely understood problem of Oedipus complex at 2.5 and at 4 to 5. But I personally do believe that there's definitely an onset at 2 to 3. There's no doubt about it. The dreams are very clear. And similarly, Freud believed that guilt starts only at the end of the Oedipus complex. He said guilt is the hair of the Oedipus complex. But Klein believes guilt is present right from birth, because the operation of guilt can be seen very early in the psychological life of the child. And I too believe in Klein that guilt is inborn. It is not connected to the resolution of the Oedipus complex. So the guilt is not essentially a retrospective application onto the Oedipal phenomena of something which develops after the end of the Oedipal phenomena to fortify the resolution of the Oedipus. Rather, it is there right from birth. This is more near to Jung's conceptualization of the archetype of the moral complex inherent from birth. So Klein believes guilt is there from birth and it is not the product of the resolution of the Oedipus. I too believe in what Klein says, and Klein talks about pre-Oedipal pathology. Now this is very important, because even if we take Klein's Oedipus at 2.5 years, even if we take the preponed Oedipus, Klein's Oedipus, the core of pathology happens much before 2.5 years. So the Kleinian phenomena that Klein is referring to as the core of pathology is before 2.5 years. So the Kleinian concepts and the Kleinian phenomena, they happen before 2.5 years. So if they don't happen right, pathology is created, the core of pathology is created, and with that pathology, if one enters into the Oedipus, whether it is 2.5 years or 4 years, the pre-Oedipal pathology makes it even more difficult for the person to navigate through the Oedipus successfully. So Klein brings into focus pathology which is before Oedipus. So for Freud, Oedipus complex was the core for most of the pathology. In some cases, it would be regression from Oedipal phase into anal phase, for example in OCD, or into the state of primary narcissism in case of psychosis with negative symptoms. But the centrality was of the Oedipal phase for 75% of pathology. But Klein talks about other phenomena which happen before Oedipus, and they too are equally powerful, equally central to creation of pathology. So Klein's discoveries, they create this whole area of pre-Oedipal pathology. That even before the Oedipus happens, pathology can be created, and in fact, if it is created and one goes into Oedipus with pathology, it's very difficult to navigate successfully into the Oedipus. So pre-Oedipal pathology predisposes you to Oedipal pathology, and in most cases, Both pathologies exist in adults because the pre-Oedipal pathology predisposed you to the Oedipal pathology. So most people who have pre-Oedipal pathology also end up having Oedipal pathology. In personality disorders and in many cases of psychosis, you can see it very clearly, coexistence of pre-Oedipal pathology and Oedipal pathology. Let us now get into the center of Kleinian thinking, clinical thinking. Klein starts with the concept of part object. Klein says, early days of life, the child does not know that the breast of the mother belongs to a person called the mother. The child relates only to the breast. Child is not able to see that this breast to whom the child is relating to is part of a person called the mother. And this relationship is what Klein says is part-object relationship. Early in life, the child relates to the part object. Slowly, the child realizes this part object is a part of a larger full object called the mother, and this creates full object relations, or normally we call object relations. So when we say object relations, we usually refer to full object relations. When we have to say part object relations, we use the word part object relations. Klein starts with the first and very important concept of the paranoid schizoid position. It is called the PS position. People use a short form, PS. Klein says, when the child is hungry and the child gets the breast, the child gets warm milk, and that suits the anxiety of survival. It is also pleasurable to have milk. The act of sucking itself is pleasurable. The fact of the face touching the soft breast itself gives tactile pleasure. So there is pleasure not only of taking care of the stress of survival, there is pleasure in the oral sucking, in the oral activity of sucking, and there is pleasure in the tactile touch on the face of the breast. This is the pleasant state when the child gets what it wants and the child believes all the good things of the world are into this good breast. So when the breast is giving the child all it wants, when the breast is available on demand, the child feels the breast is a good breast and all the goodness of the world is inside the breast. Because at that point, the breast is the world to the child. Child relates only to the part object, the breast. When the child is hungry and if the breast is not there, and obviously such times are going to come in life of every child, that the child is hungry or the child wants pleasure and the breast is not available, the child is incapable of thinking about the concept of absence and presence. So the child feels there is a bad breast which is present, which is withholding all that he wants. Because the concept of absence is not something understood by the child. This leads the child to feel rage towards the breast, the bad breast. And in that rage, the child uses all his aggression, which comes from deflection of the death instinct, or rather, and or I should say, rage at the frustration of desire, and puts this aggression onto the bed breast. The child attacks the bed breast, of course in fantasy, because the child is living practically in fantasy. The constitutional sadism of the child and the constitutional imagination of the child, they also come into picture. So how torturous, how intense the attacks are on the bed breast depends upon the constitutional levels of aggression, sadism and imagination of the child. It also depends on the sensitivity of the child, how much pleasure is being denied, how much pleasure he could have had. These attacks continue on the breast. If the aggression and sadism is too severe, the attacks can be where the child not only attacks and beats the breast, but disintegrates it and throws it into pieces all around. Despite doing all this, if the breast is not making, the good breast is not making its appearance, very soon the child starts feeling powerlessness. That it has used all the power it had, but it could not make the good breast appear. This creates a sense of disappointment, a sense of helplessness, a sense of inferiority, that he could not do what he wanted to do. He could not make happen what he wanted to happen. In fact, before attacking the good, before accepting that a bad breast exists, for some time, the child starts fantasizing that there is a good breast. And it starts even showing the suckling movements of the mouth. But very soon realizes this fantasizing will not give it the real milk or the real pleasure. So a good breast is present, good breast is not present, so the child fantasizes, cannot make do with the fantasy. The child fantasizes a bad breast, child attacks the bad breast, attacks prove in vain, child feels powerless, and now the child is fearful that the breast it attacked will now attack him with even more ferocity. It will be even more torturous and mutilating attacks, more brutal than the brutality with which it attacked. And how much brutal it will be depends upon the catastrophic thinking which is inherent in the child. If there is no catastrophic thinking but a positive thinking, then you can have severe attacks but very mild counterattacks. So it depends upon the level of positivity or negativity in the child. If the negativity is high, catastrophic thinking is high. If positivity is high, the opposite of catastrophic thinking I have coined as catastrophic thinking, that is high. But for most children, the catastrophic thinking is high, and therefore they fear the attack of the bad breast, which is going to be brutal, torturous, mutilating and deadly. But there is no way the child can prevent it, and therefore an intense feeling of inferiority and helplessness is experienced by the child. So the child alternately has experiences of good breast and experiences of the bad breast. When the child is experiencing the goodness of the good breast, the child feels the good breast is all good, all the goodness of the world is into the good breast. It is an omnipotent good breast. And when the child experiences the attacks of the bad breast, the child has high amount of anxiety. And he experiences the bad breast also as the omnipotent bad breast. So when he is experiencing the omnipotent good breast, he experiences ecstasy. When he experiences omnipotent bad breast, he experiences terror and pain. And these two alternate, because very soon the mother comes and the good breast is available. After some time, the child may again need the good breast is not available. The cycle goes on till the mother comes back and the good experiences are re-established. Over a period of time, so this is a situation which Klein calls paranoid schizoid position or the paranoid schizoid state. Position is a better word. Paranoid schizoid position. I should not have used the title state versus state. Position is a better word. This is a situation where the all good breast and the all bad breast are alternately experienced. They are separate. Because the all good and all bad are kept separate from each other, it's a schizoid position. Schizoid meaning keeping things separate. So the child's mind keeps the all good and the all bad separate. It's a schizoid position. At the same time, the child alternately experiences ecstasy when it experiences the all good breast and paranoia, terror, when it experiences the attack of the bad breast or is anticipating the attack of the bad breast. So the child experiences ecstasy, the child experiences paranoia, and they are both kept separate, alternately experienced. Because the child experiences paranoia and because the good and the bad are kept separate, Klein calls this position paranoid schizoid position, in which there is an element of being paranoid. The child is paranoid when he experiences the attack of the bad breast, and the good and the bad are kept separate. In this position, there is also the experience of ecstasy when the child is experiencing all good breast. That has not been factored in by Klein. And we'll come to it later why that is a problem. But to start off the Kleinian discussion, the first position the child is usually in the first 3 months of age, it is the paranoid schizoid position. In between the time of 3 months to 6 months of age, usually it may vary slightly child to child, but usually 3 to 6 months, slowly the child starts understanding that there are no two breasts, but actually it is one breast which is making appearance and which goes away. So the child starts understanding the concept of presence and absence. And this creates in child many emotions. The first emotion is the child realizes that it attacked the breast, thinking of it as the bad breast, when in fact it was the same breast which was giving him so much of pleasure. And therefore, there is an element of guilt that the child attacked the breast which was giving it so much of good things. Because the bad breast does not exist, it's only one breast which exists. And the breast was not by intention withholding something, it was just absent. So the thought, the idea the child had that the breast had to be attacked because it was withholding was not correct. And The child in this ignorance had attacked the very breast which had been so benevolent, and therefore there is an element of guilt which comes up. There is an element of pain which comes up. At the same time, the child realizes it is one breast which appears and disappears. In the sense, it is present or it is absent. And therefore, it is neither all good nor all bad, it's a combination of the two. So it realizes the omnipotent all bad breast does not exist. So it is saved from paranoia. Because the all bad breast does not exist, it is saved from paranoia. At the same time, all good breast does not exist. So ecstasy goes away. So there is a simultaneous loss of ecstasy and paranoia. And the child gets into a realistic zone. But the loss of the ecstasy is felt as depression. The loss of paranoia is felt as relief. There is a positive feeling. So the negative goes, you come back to zero. But the positive goes, you come back towards zero. On one hand is relief, on the other hand is sadness. Both put together, the sadness usually overcomes the relief, and therefore one experiences a depression because of the loss of the all good breast, the consequences of which overpower the positive consequences of the relief from paranoia. So this is a depressive position, and one experiences intense sadness. According to Klein, the central problem in pathology is that person is into a paranoid schizoid position, and the goal of therapy is to go into depressive position. As we go deeper into Kleinian understanding, we'll elaborate what all constitutes paranoid schizoid position and what all constitutes a depressive position in various contexts of pathology and life in general. But paranoid schizoid position is a position of split open. There is a split. The same realistic object, which is a combination of good and bad, is put into two parts, all good and all bad. And closing the split means bringing the two together into what realistically the object is, a combination of good and bad. In adult life, we often see the same situation. We can see a person as all good or all bad, when in fact he is a combination of the two. So when we see him as a combination of two, we are in a depressive position, adult position, mature position, wise position. When we see the person as either all good or all bad, we are in a paranoid schizoid position. We are not in a mature adult position. It's a poetic view we are taking, not a rational, wise view that we are taking. So for Klein, the core problem is we are in a paranoid schizoid position, and the solution is to get into a depressive position. But to do that, we have to be prepared to go through the sadness of the depressive position. Most children move from paranoid schizoid position to the depressive position and carry their journey forward. Some children are not able to make this movement of health, and they remain stuck in the paranoid schizoid position, and the split remains open. The extreme thinking of all good and all bad remains open. Alternate experience of ecstasy and terror remains open. Splitting of the realistic breast into all bad on one side, all good on one side, that split remains open. And if the split remains open, then the problems continue, because The split means we will alternately experience ecstasy and terror. And the terror is accompanied by many other feelings of inferiority, helplessness, powerlessness, pain, sadness. Klein asks the question, why does the split not close and remain open in some children who are troubled? And the reasons are this. One, if the good breast has been present for a short time and absent for a long time, there are more bad experiences than good experiences. And whatever little good there is, if you try to combine the two, the bad experiences are so many that they would completely negate any good memory that we have. There are too many bad memories. So if you put all of this together, the good memories just would disappear in the bad memories and nothing good could be saved. But we need to save some good inside of us on the basis of which future life, future motivation can be done. So to preserve the experience of happiness, positivity, optimism, joy, motivation, and energy, and not to fall into an endless trap, endless ocean of sadness, helplessness, powerlessness, and so on, we have to keep them separate. That's the only way we can save the core of goodness in us around which we are going to build the constructive part of our life. So that is one reason why in certain children the split remains open. It is kept open by the system to preserve whatever good there is. Second, the good breast may be present much of the time, but there may be too much of aggression constitutionally in the child. And because the aggression or sadism and imagination is very high, attacks are very brutal and intense, and the fear of attack is equally difficult. So even though the good breast is present most of the time, the bad breast experiences are very high because of too much of constitutional aggression, imagination, sadism. In that situation also, split is kept open. Third reason is, which Klein does not give, but I have found it to be true. There is an addiction to the ecstasy of the experience of the good breast. I call it, this experience of all good breast is so addictive that we just can't give it up. So we got relief from paranoia of the bad breast, but not at the cost of this. This is just too priceless to be given. This all good breast in retrospect is experienced by the adult in two ways. People visually recollect something dazzling, something golden. There is a dazzle of that splendor visually and affectively ecstatic. And when we look at the child, there are four elements to this experience of the all good breast, which is addictive. First, there is a dazzle of the splendor. There is a soaking in that ecstasy. There is this hypnotic capture by the all good object, and one is frozen in wonder at the all good object. All of these are descriptions. The core is, one is dazzled by the splendor of the good object, and one is captured by the addictive ecstasy of the experience of the all good object. And therefore one does not want to close the split because one does not want to give up the ecstasy of the all good object. One more reason I failed to mention, I forgot to mention. If the sensitivity is very high, the readiness to face the sadness of the depressive position may be too intense, and that also is a reason why the split remains open and is not closed. So for these 5 reasons, split may remain open, and if the split is open, the adult will feel the difficulty and pathology will build up based on this split. Klein brings 3 more concepts: envy, greed, and reparation. Klein says all the 3 are inborn. Envy is feeling envious to anything good outside of us. Feeling this uncomfortable feeling, negative feeling of envy, which does not allow us to be normal or happy when we see goodness outside of us. And very soon, envy uses aggression to attack the object which has goodness outside of us. Klein says envy is one of the central problems to be overcome. Envy is not something ephemeral, it is central. When the child gets everything from the good breast, the child is also envious that the good breast has all the goodness of world into itself. And the child attacks the good breast out of envy. So the child's aggression is used in 2 ways. The child attacks the bad breast out of aggression and frustration, and child attacks the good breast out of envy. And this also creates guilt. Just as the realization that there is only one breast, a greater realization that I attacked the good breast even while I knew it was the good breast. And I attacked the breast wrongly thinking of it as the bad breast. In wrongly thinking of it as the bad breast, the guilt will be low, but in envy, the guilt is very high because one does it very consciously. Resolution of envy, according to Klein, is gratitude. That we develop the idea of the capacity of feeling gratitude to looking at something outside of us as good. This goodness that we can see and experience, that itself calls for gratitude. So goodness outside of us, if we respond with gratitude and not envy, that is the healthy counterpart of envy. So the therapy goal is first to move from paranoid schizoid position to the depressive position. Second, to move from envy to gratitude. Similarly, greed is inborn. The child wants to rob all the goodness of the breast and make it his own. He does not want any goodness to be outside of him. He wants to collect everything inside of him and hold it and not give it to anybody else. So greed is also a very important element. Often it comes out, greed comes in terms of one is confused. When you have approach conflict, I want this also, I want that also, when in fact the two are mutually exclusive. I want milk and I want curd, when in fact you can only convert milk to curd. It can only be one, but I want both of them, so I cannot decide or I get angry. So this is greed. According to Klein, the third important element of therapy is to move from greed to generosity, from accumulating everything to be able to give out things to good objects. Very important in Kleinian thinking is reparation. When the child knows it has damaged the breast in fantasy, the child tries to reconstruct the breast, to repair the damage. And this, according to Klein, is the first act of creativity. Reparation done to undo the damage of the attack on the breast is the first act of creativity. And this, I would say, is purposeful creativity, conscious purposeful creativity, or let me say a semi-conscious purposeful creativity. Because in creation of objects or in psychological movements, there would be creativity even before this. In the perceptual process itself of the part and the full object, there would be creativity. But in the utilitarian sense, this would be the first act of creativity. Not in the process sense. But Klein talks about this as being the first element of creativity. Reparation, and this is very true. Whenever we damage an object in real life, whenever we hurt a person, we try to undo it by being good to the person, by undoing the damage, not only undoing, giving the person something more to please the person and undo our act of attack and damage. Envy is one of the most difficult things to accept because it almost looks like pure evil. We can justify other things, but very difficult to justify envy. And we should recollect that all these elements, envy, greed, reparation, all of them have survived evolution, so they must have some evolutionary value. And the sublimated form of envy is healthy competition and healthy inspiration. That the good outside of us should inspire us rather than make us destructive. So healthy competition, healthy inspiration, healthy motivation is the evolutionary sublimated intention why envy is there in us. Usually envy is towards objects, but it is possible to experience pure envy without an object. The way it happens is usually we experience envy towards objects. Slowly we start, when we work upon it and we put it aside or we get over it substantially, we start experiencing envy towards goodness inside of us. So first we experience envy towards goodness outside of us, and that seems almost like narcissism, as though envy was an element of narcissism. But later on we realize envy can attack even the goodness inside of us, and that is where we know very clearly envy is different from narcissism. And the third stage is we can experience pure envy as it is, neither towards any object outside nor towards our own goodness, but a pure affect as it is. Greed can be sublimated to accumulation of good things in life. Accumulation of virtues, accumulation of ideals, accumulation of knowledge, accumulation of good things to be used for social good. Those are sublimated forms of greed. So the goals of Kleinian therapy are: first, move from paranoid schizoid to depressive position; second, envy to gratitude; third, greed to generosity; fourth, learn the act of reparation; and fifth, and very importantly, internalization of a good, reliable, stable object in long-term therapy. One more point before we move ahead. Some people talk about the possibility that what if in some children the split does not just open up. So the opening of the split also is important. The split has to open adequately and then close. This is the healthy situation. If the split is not adequately opened and closes, the person is not able to do clear thinking. He is not able to clearly separate the good from the bad, and he is confused. He can't make out the friend from the enemy very clearly. He is confused because the split has never adequately opened. So extreme thinking, the capacity of extreme thinking also is necessary, just as the capacity of balanced thinking is necessary. There are situations that demand both of them. If a unique phenomena happens where the split closes, again opens, again closes, again opens, if this kind of thing happens because of some stress in the environment or some other event, then the person is perplexed. The same thing appears all good, all bad. Suddenly it appears realistic, a mixture of the two. Suddenly it appears extreme, suddenly it appears realistic. So the person is perplexed. It's a special kind of confusion. It's a perplexity, where the split opens and closes, and the man is left perplexed. Some important academic discussions on Kleinian concepts. First, there is a split related to split. Ordinary understanding is, let me not say ordinary, conventional understanding is split is all bad, depressive position is all good, which is not true. Many good things, brilliant ideas, works of art, extraordinary energy, extraordinary project execution, extraordinary states of happiness, they all appear in the split position. And the depressive position often is the position of the average person, not that of an extraordinary person. So split is all good and depressive, split is all bad and depressive position is all good itself is a split about split. There are good and bad parts related to the split position, the paranoid schizoid position, and there are limitations of the depressive position also. Depressive position is not conducive for art, it is not conducive for spiritual exploration, it is not conducive for any extraordinary effort. So there are strengths and limitations of both the split position and the depressive position. Second, is depression a part of the depressive position, or is the depressive position wrongly worded? Opinions are on both the sides of the issue. My personal feeling is that depression is an inevitable part of the depressive position, and Klein has rightly worded that position as the depressive position, because the sadness of losing the ecstasy of the all good breast is for most far more than the relief that one gets from being saved from the paranoia of the split. Third important element is, and in fact, for many people, the inability to give up the paranoid schizoid position is because of the good and the ecstatic element of the paranoid schizoid position and the depression which one does not want to undergo. In many personality disorders, we see this very clearly. The non-readiness to go through the inevitable depression one will have to go through. Third is internalization of the good, reliable, stable object. This may not happen because of envy of the good object. This may not happen because of the good object not being reliably present or the object in front of you not being good enough. Or in some cases, the inborn idea or the taste is such that the standard how something can be thought of as good is so high that the real object just does not qualify to be a good object. And this brings us to actually a Jungian idea of inborn ideas, the archetypes related to the fundamental Platonic categories which might be at play. We don't know, but this is a good direction to move thought into. That internalization of a good, reliable, stable object may not happen because of variety of reasons. And this is central to our psychological health, even to the health of immune system according to some sources. That immune system also works good if there is an internalization of a good, reliable, stable object. Omnipotence. This is a very important concept. How we seek omnipotence across our life, and when we ourselves cannot become one, we want somebody to be omnipotent. If he is not, we project onto the person, identify with the person, and then live out our omnipotence. This is pervasively in vogue when we look at celebrities, leaders, kings, royalty, heroes in any areas of life. And if nothing works, we create mythology and literature. But somewhere an object has to be created, endowed with omnipotence, identified with, and that allows us to live out our own quest for omnipotence. This is a characteristic of human beings, not fully understood and used by psychoanalysis or psychotherapy in general. The whole area of the surreal is a very interesting area, how we can look at object relations, representational world, and the fundamental operation of the surreal processes. Someday I will take it up, the whole idea of the surreal and the Kleinian representational world. Kleinian therapy is one of the most difficult therapies to go through. Very difficult to swallow, very painful to go through. Often very confrontational, not in tone, but in meaning. It's a very good therapy for pre-Oedipal pathology, very good therapy for psychosis, very good approach for those who are understood in the most, who are interested in the most elemental ways in which the mind works. And those of you who wish to learn more about the Kleinian theory should read Klein, understand some Kleinian concepts, attend more of Kleinian classes or videos, and after a reasonable grounding in Klein, go on to works of Wilfred Bion, Meltzer, Hannah Siegel, or Betty Joseph. Hannah Siegel has done good work in making Klein more easy to understand to people, readers. You can look at Hannah Siegel's work. You can also go to the Kleinian Trust website, kleiniantrust.org, I believe, where you find good material on Klein. If you want to do it deeper, you can go to Tavistock Clinic in UK, which is still today the central center for Kleinian thought. Let us look at some of the Kleinian explanations for the 12 common psychological disorders. We have taken up the same 12 from a Freudian standpoint also. From a Kleinian standpoint, anxiety spectrum disorders essentially are because the split is open and there is a fear of attack of the bad breast. Depression is because a sad mother or a cold mother is internalized. A sad object is internalized and then one identifies with that sad object. Second explanation, it is because of loss of a good object. Third, obsessive compulsive disorder. This is because the split is open. That creates anxiety of attack of the bad breast, and this anxiety goes into repetitive compulsive movement or obsessive movement. In Freudian thinking, the anxiety was generated because of non-resolution of Oedipus. Here the understanding is it is because of the split being open. That does not mean Klein would not agree that it can be out of Oedipus. Klein also accepts the Oedipus. But in more cases than not, Kleinian explanation would be the split is open. And the anxiety of the split then goes into the repetitive obsession or compulsion. Or it may be object loss which leads to anxiety. So it can be object loss or object attack which leads to anxiety, which then goes into the disorder. Paranoia is because of the attack of the bad breast because the split is open. Erectile dysfunction is because of the Oedipus. Klein accepts the Oedipus. Panic is because the bad breast, our attack on the bad breast has ended, achieved nothing. The bad breast is still intact, and now the bad breast is going to attack us with all the ferocity. So a bad breast attack is about to come. Social anxiety essentially is because of the bad breast is projected onto people, and then we fear they will attack us en masse by judging us, mocking at us, humiliating us. So normal people appear to us as attacking people because the bad breast is projected onto those people. Fragments of bad breast are projected onto them. Psychopathy is explained by a combination of the split being open and two things happening. One, identification with the all good breast, which gives rise to narcissism, where one believes one can get away with anything. Second, no empathy. And third, the attack of the bad breast can lead to a preemptive attack. And fourth, the guilt and empathy not being there, even if it is not a preemptive attack, it may just be the death instinct being very strong, which has to be projected outside, sadism being very strong, and identification with the all good breast. So narcissism, sadism, and too strong a death instinct which needs to be projected out, and absence of guilt and empathy. That would be the second explanation without taking recourse to preemptive attack fearing the attack of the bad batch. Sadism is again because of low guilt, low empathy, very high death instinct, which needs to be put on outside some object which is seen to be bad. So it is a state of attacking the bad object. It is not a state where the attacking has ceased and that's a fear of attack. It is the attacking the bad object with a positivity that the object will not attack back. What I call the apostrophic thinking in the unconscious, of course. Masochism is the object attack being accompanied by pleasure, which is a replica of the childhood event where the parents attack and then do reparation. And in the reparation, pleasure and love comes. So it is object attack followed by object love. So it is invitation of object attack in order to invite love that would follow. It can also be very strong death instinct which cannot be deflected out, which goes on to oneself, and secret intense pleasure related to that death instinct. Self-destruction also can be very intense death instinct which cannot be deflected out, and identification of self-representation with representation of somebody against whom one has rage, and with this representation the self is attacked in order to attack the other. Narcissism is explained by identification of the self object with all good omnipotent object, which leads to this sense of grandiosity and self-sufficiency, which leads to this sense of splendor and ecstasy. So we see, except for erectile dysfunction, most of the disorders have a separate Kleinian explanation. In erectile dysfunction also there is a Kleinian explanation where the bad object is put into the body of the partner, and there is a fear that the brutal sadistic bad object will attack the sexual organ or our body, and therefore the very sight of a bare body leads to erectile dysfunction. So we can see, and of course in one group of patients it will be Freudian reason, another group of patients Kleinian reason. So we can see, actually if we go deeper and we even bring up the rare explanations, for all the 12 we had different Freudian explanation, and for all the 12 we have a different Kleinian explanation. We'll take up similarly other schools to explain the same common disorders. Thank you. Any questions, write to me at hvindia@gmail.com.